talking about Caribou Bioscience. They had a data dump yesterday. The stock was down 20%. Overall, the news is not bad at all. It's just that it's not as good as people thought. And about a month ago, they had good data on the same trial. The stock was up probably 30%, and now it's basically back down. I want to talk about this and also use this example to explain how we look at our biotech side of things. We have lost about 11% year to date in the portfolio with our biotech index, which is huge because it was only a 20% position. So we basically lost half of that position. We're down 50%. Now, given what the markets have been doing, it's not the end of the world. It's just underperforming slightly. But nevertheless, it's a problem. We need to discuss it. The purpose of this podcast is to give people a sense of what it feels like to run a hedge fund. And we've said many times volatility is part of the game. Well, this is what volatility means. We are still committed to the position because the big decision to be made here is, okay, am I sitting on a dead horse here, or is this just market reaction, cycle, that kind of stuff? This is the fundamental question. This is not even on podcast. It's June 11, 2022. This is Krim Delco. It's a Saturday no update. For the year, we're down 45%. The market's down 18%. We're underperforming by 27%. So Caribou Bioscience had another data dump. Data dump is just, you release data on a trial. And they released data on a trial that they've released data about, I think about a month ago. So this is just an ongoing trial. And I'm going to try to do this in a Popperian way. So I'm reading from right to left. In other words, I am not going to talk about definitions, medical jargon, and all that stuff that other people, particularly, let's say, YouTubers, are using, in my view, way too much technical jargon just to sound more professional and all that. And that's fine. It certainly helps if you use the jargon when talking to other people that know how to use the jargon. This podcast is not one of those. So I'm going to try to do right to left. In other words, I'm going to try to keep it, okay, what is this trying to achieve? What are the goals? What is upside? What is downside? That kind of thing, because I think that's what really matters from an investment perspective. So what Caribou Bioscience is trying to do is the following. They're trying to introduce allogenic CAR T cells into the cancer space. So what does that mean? So we have T cells. Every human has T cells. Their job is to go and attack things in the body that are not supposed to be there. And the problem with cancer is that the T cells of a human seem not to be able to attack cancer. So immunotherapy, which is the idea that we use our own immune system to attack cancer cells, has been going up and down sort of over the last 100 years. There's a very good book written a couple of years ago about the history of immunotherapy. Forgot the name. I can put it in the show notes. But the point is this, that we had immunotherapy, again, about 100 years ago, popping up in the medical community just because there were some people that had cancer and then it just went away. And the idea was, well, it goes away the same way a cold goes away or COVID or whatever, because our own immune system deals with it. And quite frankly, if we didn't have our own immune system, of course, we would be all dead and extinguished a long time ago. So why isn't it working with cancer? Well, the idea is that our own T cells are getting fooled by the cancer cells. So what CAR T cells are doing is two things. One is you have to make sure that these T cells that you're programming, meaning that you're evolving, or let's call it programming. I'm going to explain what I mean with programming. But you take a bunch of T cells, you program them so they can be injected in a patient's body, and they can actually go and kill cancer cells. So they need to overcome that evolutionary trick that cancer has used, which is to fool T cells. So you overcome that. And there are ways to do that. But the other big thing is, of course, the immunoresponse. So if you inject T cells that are modified, then you will have an immunoresponse, because our body is very good at recognizing stuff that doesn't belong there. Unfortunately, it doesn't do that with the cancer cells, but it does it with pretty much anything else, particularly with immunotherapy, because the big thing that happened in immunotherapy is that people tried to inject all kinds of immunotherapeutic agents into bodies, And usually, a lot of times, people react in bad ways so that their immune system can't take it. So what you do in allogenic CAR T therapy is the following. You take off-the-shelf cells, and I'm not sure if it's T cells or whatever, but let's say they're T cells. You then program them in such a way, and you can do that, we have the technology for that, that they can be effective as T cells and that they can be recognized as your own cells by the patient's body. That can be done because we have a way, and there has been a Nobel Prize for that, that we can take any kind of cell and put it back into what's actually a plutocratic stem cell and then reprogram. So you can take a cell which has been specialized, let's say a T cell, from a healthy person, put it in a shelf or in some sort of freezer or whatever. I don't know how they shelf these things. Leave it there for years, and then when it's needed, take it out. You can reduce it to a plutocratic stem cell. So you can take that specialized T cell, make it such that it's basically omnipotent, and then reprogram it to become a T cell for a specific cancer with the specifics of the patient's body so the body doesn't reject it. This is the idea of allogenic CAR T cell immunotherapy. And what Caribou Bioscience has is a technology, they call it Chardonnay. It doesn't matter. Again, I don't want to be hung up in jargon here. All they have is they're saying, look, this workflow that is necessary to take healthy people's T cells, be able to store them, reprogram them to be injectable in any kind of patient. This all workflow can be scaled up, scoped up, so you have more scale and more scope. You can do more kinds of cancers in more scale, lower the cost, make it more effective, make the iteration more effective, which is another big deal. So you obviously will not hit the jackpot here the first time. You need more iteration. So when everything is said and done, the actual workflow needs to be industrialized, and this is what Caribou Bioscience is trying to do with this Chardonnay technology. There's other things they do, but this is the big one, and they are now starting trials with this technology. It's based on CRISPR, by the way, and I'm going to give a brief overview of a Caribou just in a second, but let me just finish this train of thought. So what Caribou is doing is, again, allogenic CAR T therapy, which is take off-the-shelf T cells, program them in such a way that they can be injected in any patient and solve any cancer, hopefully. Right now, we're obviously not there yet. We just are able to solve one particular cancer. I think it's some sort of blood cancer. Anyway, again, I don't want to be caught in all this nomenclature and jargon. The point, hopefully, is that I'm able to get across here is you have a patient, the patient gets injected off-the-shelf T cells, and the purpose of this injection is so these T cells go fight the cancer. This is the idea, and the first data dump about a month ago showed that a bunch of patients had good response. This data dump showed that still a bunch of patients having good response. However, some of the patients, the cancer comes back, and this is the problem. That's why the stock was down. Because what you want is, you don't just want to have a response and then after 6 months or so, the cancer comes back. And the way I understand this is the following. If you fight, let's say you're fighting an army. Let's say you're fighting Russia. You can keep fighting their army, which is the equivalent of programming CAR T cells to fight the cancer. You can keep fighting the army. Or you can maybe find the cause of why are you fighting this, which in the case of Russia might be, let's say, the malintentions of Vladimir Putin. So how about you just try to get rid of him, or try to reprogram him, or convince him not to fight wars, or something like that. So if you could find the cause of the problem, now back to cancer, which unfortunately science just isn't ready yet. We're not there yet. We don't know what the causes of cancer are. We're guessing, so we don't know. But if we can just fight the cancer cells, then at least the patient can still be alive, and this is the key, or the spreading can be stopped. The way I see allogenic CAR T cell therapy is, it's a highly targeted chemotherapy, basically. So it's or radiation, or maybe it's both. Actually, it's not radiation. It is chemo. You're putting molecules into a body, so it's chemotherapy, but it's targeted. So it doesn't just kill everything. It only kills the cells that need to be killed, which is, of course, a much, much better deal for the patients. By the way, allogenic versus autologous. So I'm sorry, I said I don't want to use jargon, but these two are important. Autologous means you have to use the patient's own T cells. That's what autologous means. And that's how this whole T cell therapy has started way back. You use the patient's own T cells, you reprogram them so they can go back and be used. The problem with that is it's very expensive, it takes a long time, and typically a cancer patient's own T cells are already weak. It's usually older people, all that kind of stuff. So it's not a good thing. Allogenic means you can take anybody's. You can take Michael Jordan's T cells. You can take the guy who just won the Ironman's T cells. In other words, you can take very healthy people's T cells, reprogram them to be injected in an 85-year-old cancer patient. This is what is so great. In my view, allogenic CAR T cell therapy is the biggest thing in medicine since penicillin. I think it's huge. That's why we have these massive market capitalization, or we had them with Caribou, with Intellia, and all these other companies, because they're all working on similar problems. Not only, again, Intellia has other things they're working on, but this is one that, if this can be cracked, if this can be solved, this is trillions and trillions of dollars. And we just had a podcast yesterday about Peter Thiel and how he talks about, build a monopoly, start a small market, build an innovation stack, don't go after big markets, all blah, blah, blah. So are we basically, why are we doing this? Because we have this tiny company, Caribou, which is going after $1 trillion market, right? So you might have this first knee-jerk reaction, or maybe if I had a beer with Thiel, he would say, don't waste your time, because they're never going to succeed. Even if they're good at it, the competition is not going to let them succeed. Now, I have a different view. I think when it comes to these types of terminal disease type solutions, it's not exactly like you're talking about Coca-Cola here or an insurance company. In other words, I think there is a case to be made for companies that come up with a solution to such a big problem like cancer, that they can actually come from very small bases and generate wealth for investors. Maybe it's going to happen through M&A or licensing or those sort of things. But we've seen it with Moderna, we've seen it with, whenever the shit hits the fan, the proverbial shit hits the fan, and then there's a solution for things, money is being made. So, and that's simply because there is no competition, there is no solution, the status quo doesn't work, patients are not, you see, if you are using Geico now, and you have a disruptive insurance, let's say like Tesla, I mean, you can still survive if you use Geico. It's not going to be the end of the world. Even if you pay 30, 40, 50% more, it's not going to kill you. And most people don't even know how much they pay for their insurance. But when it comes to cancer, the stakes are just different. So I think, again, maybe these are the last words of any investor, but this is different just because the field is different. And you could also say, well, you could use, Clayton Christensen's disruption theory here. There is no market for allogenic CAR T cell therapies. There just isn't. There's no demand for it because it doesn't exist. So if you come up with something, and this something, by the way, and now this follows Peter Thiel's analysis very well, which is this is orders and orders of magnitude better and orders of magnitude cheaper and more cost effective. And this is particularly what Caribou is doing. And now I want to talk a little bit about Caribou because I want to also explain why we invested in Caribou. Caribou is basically, I think it's the first company that came out with the CRISPR complex. It is founded by Jennifer Doudna. It is the mother company of Intellia. That's why Intellia yesterday took a 14% hit also. So they're all related. Now, I don't know the exact story. I think what happened is when Doudna did that whole discovery with Charpentier, and Doudna immediately started a company to have something where there's IP, there's lawyers involved, and then there's some research being done. And the whole thing was under the mantle of Caribou. And then they spun out Intellia. They said, okay, let Caribou be the research arm, and then we just keep spinning out stuff. Now, why is Caribou public? Well, they thought that to themselves a couple of years ago, well, okay, we've done a lot of sort of workflow research, sort of industrialization of CRISPR. We have a platform now that can be useful for this particular problem. And we're going to license IP to other companies like Intellia, but we're going to keep doing this ourselves now. This is too big to be outsourced to another company X. Why don't we just keep it in-house? This was the thinking, so that's why Caribou went public. And again, I think the big thing, and this is now very personal to Jennifer Doudna. I've never spoken to her, but I've read a lot about her, seen a lot of interviews, heard a lot about her. And the way I interpret her action is, I think she wants to be actually more in the tools and supplies business. So in other words, she wants to, of course, find the gold, but she also wants to develop better axes and picks, better flow technology to find the gold. Now, she wants to work on the tooling. She's invested in Syntago, which is another tooling company, if you want, for the CRISPR space, workflow, tooling, those sort of things. Because as we at Orange Capital Partners always say, as let's say Glenn Shotwell just said recently at her Stanford presentation, this is not about space, but it's all the same thing, which is, look, we can all disrupt and innovate in many, many sectors. But if we don't find a way to manufacture at scale at low cost, the changes will be only pedestrian. So in order to have real big change, we need to find an industrial way to produce, mass produce stuff at lower cost. And this is what Caribou is doing, because I think Jennifer Doudna wants to do that. And as a researcher, she knows how difficult it is to get stuff done. And if you can industrialize stuff, it just goes much faster. This is, again, I'm reading from right to left here. I'm using very rudimentary explanations, and I'm staying away from definitions and jargon. So anybody who's a scientist or an expert in this field might think that I'm way too superficial, but it is intended. It's not because I'm too lazy or anything. I don't have the knowledge of all the jargon, but I don't think it's necessary for the purpose of this podcast. This is why I'm keeping it very high level. So to summarize, actually before I summarize, I just want to give the conclusion. The conclusion is that we're still invested in these stocks because they do represent massive potentials for huge breakthroughs in something that is going to be very beneficial for society. And to follow Peter Thiel's argumentation, so the X, which is the benefit to society, is very high, and then the Y, which is how much can I capture? Well, given the market caps of these companies, which altogether they are maybe now in the 20 billion range, they used to be in the more like 100 to 200 billion range, so they came down a lot. But even 200 billion at their peak, they're not even close to representing what that Y could be if the X is as big as we think. In other words, if they can help us solve things like allogenic CAR T cell therapy, which again I think is the biggest thing since penicillin, if we can get stepwise into a solution for these types of problems, then we should have enough Y. In other words, we should capture enough value for shareholders for us to generate wealth. This is the fundamental idea. This is why we're sticking with it. The data is blurred. This is not a black and white situation. It is black and white in the sense that you can have a study that says success or not success, but even success is usually very, it's almost in the eye of the beholder. In this case, we had 5 patients. 2 of them did not have a resurgence of the cancer, and 3 of them had. So there's a 40% resurgence rate, and maybe if they had been 3 out of 5, would have been a 60%, and then maybe the stock would have been up for 50%. So you see, this really hinges on very little data. We can't really use statistics here. This is the thing. The market is using Bayesian methods, and that's how the market does. It works, in not just here. The market is Bayesian. We have information, we change our probabilities, we invest. And that's fine. That's how the market works. But what's important for us investors is to understand how the market works. This is not a thumbs down by the market. This is not the wisdom of the crowd saying, this is not going to work. This Caribou is not worth it. All the market is doing is Bayesian reasoning. And we at Orange Capital Partners, we believe that Bayesian reasoning is wrong. So the market as a whole, as a sort of way, the methodology of Bayesianism is wrong. And that's fine, because that's the best the market can come up with. The way we think about it is not Bayesian. We think about it, is this a direction we think human cures should go? Is this a direction that allows for iteration and that increases our natural Sharpe ratio? And remember, natural Sharpe ratio, amount of iteration, and then hope minus errors and minus error correction. And there's some sort of formula, doesn't matter. But it's an optimization problem. I want to iterate as fast as I can because I don't know the truth. But let me try to iterate as fast as I can. Let me make sure my errors are such that I don't die. And let me make sure that my error correction is relatively low cost. This is what Chardonnay, what this technology, this workflow technology of Caribou is trying to achieve. That's why we're invested. And that's why we believe that all the other CRISPR stocks and the whole biotech complex that we have invested in is still valid. So yes, the Bayesian method by the market is, in our view, it's one way to price stocks. It's not the right way. There are better ways to do it. But this is how institutional investors, this is how the big money prices stuff. It's fine. We take it. This is kind of like saying, well, Washington doesn't work well, but Washington works the way it works, and there's elections every 4 years and all that stuff. So we'll deal with that. There's better ways to do it, and it's our job, actually. Our job as investors is to see through that fog and try to take advantage of opportunities that we see are coming out of this discrepancy between the Bayesian method of valuing stocks and the actual directional value creation that these stocks are providing. Thank you.